Hello, welcome to new talk presented by the SchrDbb. In this tutorial, we're going to see premature rupture of membranes, and preterm labor. So these are the two main things you're going to visualize in this tutorial. So in order to visualize this topic, we're going to use the SchrDbb algorithm, which is made up of the disease, differential diagnosis, endemic disease. Then we have the cause, then we have the complication, then above we have the background, below we have the prognosis. Now this corresponds to the similar diagram of the mechanism at the middle. Then here we're going to have the pathogenesis, then down we have the pathophysiology, and then outside you are going to have the epidemiology and the risk factor, and lastly we are going to have the follow-up. So those are the elements that we're going to visualize in the premature rupture of membranes tutorial. Now let's start by having definition of premature rupture of membranes. Is it clear? I'm just going to speak about premature rupture of membranes, and then I'll correlate it to preterm labor, because preterm labor can originate from premature rupture of membranes. Is it clear? So let's have the first definition of premature rupture of membranes. It just refers to a circumstance where you have rupture of membranes after the age of viability and before 37 completed weeks of gestation. And when I say 37 completed weeks of gestation, I mean that it is 36 weeks 7 days, because you have to consider that the first week of gestation is already, as if you had 6 days of gestation, it means that you are inside the first week of gestation. So 37 completed weeks is 36 weeks 7 days. Now, the age of viability now depends on the context in which you are. In our setting, Cameroon, we don't have machine that can perfuse the lung both with a positive and a negative pressure ventilation. We just have positive pressure ventilation, but just in further settings before you can have negative pressure ventilation that can also supply with surfactants in the child. So generally in our case, we consider the age of viability far up to the 20th of gestation. But in other contexts like in US or America, you can consider US or Europe, you can go up to 20, 22 or even 24 weeks of gestation. So these are the different elements. So rupture of membrane after the age of viability, depending on your context, and before 37 completed weeks of gestation, and before, sorry, not 37 completed weeks of gestation, but before labor, before the onset of labor, it is premature rupture of membranes. So let's have again the definition clear. I'm sorry about the first mistake. When you have rupture of membrane after the age of viability and before the onset of labor, it is premature rupture of membranes. Are you getting? So it means that if you have labor at 28 weeks of gestation and there is rupture of membrane at that 28 of gestation, it is not called premature rupture of membrane. Premature rupture of membrane is only called when it occurs before labor, and it's best to even say that when it's occurring 12 hours to 24 hours before labor. Is it clear? If it occurs 6 hours before labor, it's not considered to be premature rupture of membrane. It's considered to be premature rupture of membrane when it is 12 to 16 hours before labor. Now the next term is preterm labor. So what is preterm labor? It is when there is onset of labor. So there is onset of labor after the age of viability, depending on the context in which you are, and before 37 completed weeks of gestation. Now this is where you use the 7 completed weeks of gestation. So preterm labor is the onset of labor after the age of viability and before 37 completed weeks of gestation. Is it clear? So those are the different elements that you have, and 37 completed weeks of gestation corresponds to 36 weeks 7 days. As I've just explained, when you are in the second day of gestation, you are inside the first week of gestation. So 36 weeks 7 days correspond to 37 complete weeks of gestation. Now, the next element that you are going to visualize now are so after having the definition of labor, is it clear, of premature rupture of membrane and preterm labor, you should now go to the risk factors. Is it clear? Now, you need to know that what I'm going to first take to speak about the risk factor of premature rupture of membrane, and then I'll speak about the risk factor of preterm labor. Is it clear? But now there is an element that I want to point out. Is it clear? The risk factors of preterm labor has generally pathogenesis. Is it clear? So I'm going to speak about mostly about the pathogenesis of preterm labor, and also speak about the mechanism of the pathogenesis inside premature rupture of membrane, so that you have a best understanding. Okay, so let's start now with premature rupture of membrane. Premature rupture of membrane. Is it clear? So now the pathogenesis of premature rupture of membrane can be either related to an increase in intrauterine pressure, or the pathogenesis can be related to a decrease in cervical competence. Is it clear? Because you need to know that it is the cervix that is helping for in order to hold the uterus, in order to hold the pregnancy inside the uterus. And when there's also increase in intrauterine pressure, let's say that this is the uterus here. Is it clear? Here down we are going to have the cervix. Here down you're going to have the cervix. Is it clear? And the cervix is closed normally. If there is high pressure, it can result to easy rupture of this membrane, and if there is incompetence of this cervix, it can also result to this rupture of membrane. So these are the two major risk factors. So let's visualize the risk factor that increase intrauterine pressure. Is it clear? Generally, anything that results to an increase symphysofonda for gestational age can be associated with an increase in intrauterine pressure. So example, you have a uterine fibroid, particularly uterine fibroids which are submucosal or intracavitary. When you have uterine fibroids which are intracavitary, they are going to exert an increase in intrauterine pressure. Is it clear? So particularly submucosal fibroids are the one that are associated with it. But now other fibroids like intramural or subarachnoid do not really do an increase in intrauterine pressure. Is it clear? So these ones are more of submucosal fibroid. The second one, we can have polyhydramnios. Is it clear? Polyhydramnios is a situation whereby you have the amniotic fluid of more than 2.5 liters as from 32 weeks of gestation. Is it clear? So that is what is called polyhydramnios. But the diagnosis of polyhydramnios is going to be based on the height that you have at the level of the amniotic fluid contents. Is it clear? Now the third element, you have also macrosomia.